All right, well, welcome everybody to the latest VIA Live product training webinar. We're very proud to be hosting the team for the Thermocoagulator and to tell you more about that product throughout the next hour. So first, before we do that, I'd like to just quickly introduce VIA Global Health. So VIA Global Health, for those of you that are not verified distributors with us at this point, is a medical equipment platform for emerging market medical distributors that makes it faster, easier, and more affordable for you to source, quote, purchase, and ship products from around the world. And what we do is we have thousands of products, and some of them are the most leading innovations in the global health field. And you'll see them featured here, like the Thermocoagulator. And we make that an easy process where you can find all of the information you need all in one place, very transparent and very clear. So there's a few different ways you can visit the site and learn more. So obviously you can go to our About page to learn more about VIA Global Health. One of the things we try to do with our products, but also with our company, is to be very transparent about how we work, any kind of different publications and stories that have been written about VIA, any testimonials of what our customers say, any videos, and also learn a bit about the team. You can see our locations there throughout the world. But taking it back to the homepage, again, it's all about our products. So that since we have thousands of products and we're trying to make them accessible to all of our markets, we make it as easy as possible to find the products and their information. So there's an obvious way you can look by searching by category. So you can look at anything from anesthesia and respiratory down through surgery and theater, gloves, exam room, whatever is your area of focus for your business, we make that a category for you. And you can also look at the featured innovations here, which is some of the more innovative products to market, which maybe you're not aware of, or maybe it's just not yet being sold in your market. Or what you can do is go to the search, which we know is our most popular way for people to find products on the site. So if you type in thermo, you'll see different recommendations here. Obviously, we want to look at the Thermocoagulator, but in general, if you typed in anything else, ultrasound, CPAP, it would bring up all the options available to you there. So I'll click on that. And I'll take you just quickly to our product page. And this essentially is your product brochure. This gives you all of the information you need based on the thousands of inquiries we've received. We know what it is that your business is looking for your tenders, for your private inquiries with hospitals. We know that you need pictures of the product, so we provide several pictures in most cases. We know a short description, regulatory approvals are important, so we make them front and center at the top. And then you can see more product information, a more extensive description. You can see product features. You can also see different resources like the package contents. You can see a more close-up of a diagram of the product. And then you can see things like documents, whether it's brochures, instructions, sometimes clinical trials and studies. And then here's more extensive list of specifications. So if you wanted to match that to a tender or your inquiry document, you can then look at this directly and match those up. So instead of waiting days and weeks for answers from suppliers and manufacturers, and then when they give you the information, maybe it's not what you need, what we've done is put it all in one place and made it extremely accessible for you to access. Additionally, there's a few videos. Once we finish this webinar, I'll get that edited together and we'll also post this on there. So you'd be able to come back to this and use our training webinar to bring into your sales meetings and also your training with your staff as well, if they had any additional questions. For those of you on the line that are verified distributors, obviously here you would log in and see the price. For those of you that are not, what you would do here is just click on that request a quote, put in your information and your quantity expected. And what we would do is then connect you to a local distributor in your market that could have everything imported and delivered onward to you. So again, just trying to make it as fast, easy, and affordable for you to find the equipment you need. So let me just take it quickly back to the Thermocoagulator page. As we do that, I'd like to just transfer over to Dean Wallace, who is the product specialist on the Thermocoagulator. He has a few things he wants to take you through, one being a demonstration video, and then also being the specialist on this product, he would be fielding all of your questions for the question and answer section.
Yes, hello. My name is Dr. Wallace, and we're going to talk today about a new device, thermocoagulators for use for treating precancer cervical lesions. As you may be aware, over 250,000 women a year die of cervical cancer. Most of those women are in the low to middle income countries. And today we'll demonstrate and talk about a new device that makes it practical to treat these women. So first of all, let's go to the video, training video, that will go through some of the details, and then afterward we'll take answers or questions that you might have.
Hi, I'm Dr. Heather Jackson, and I'm here to describe how to use a new device that's used to treat precancerous lesions of the cervix. It's called the Thermocoagulator. It's so easy to use. This is the box that the Thermocoagulator comes in. You open it up, you have your instructions for use. You have 2 probes. You have your hand unit and 2 batteries, one to use with your unit and one to charge while you're not using it. Each battery lasts about 50 uses. Come over here, you can see the unit itself. The unit is used to treat precancerous lesions caused by the HPV virus. And it's just as efficacious as if you were to use a cryotherapy unit, and much, much easier, as it only takes 20 seconds to ablate the tissue. Ablation means to destroy the tissue, and it only takes about 20 seconds as it heats the tissue up to 100 degrees Celsius. So how to assemble the unit: you take your hand device, you take your battery, you insert it, and each probe comes with a little plastic cover. Take off this plastic cover and insert it into the top. And that's how to assemble it. This part of the device here is your LED screen. It also comes with a light so that you can visualize the cervix and the vagina. So now I'm going to walk you through how this front LED screen works. So here's the power button. Just turn on the power button. You're going to hear a series of beeps. You see the light turn on. The unit is still cool. This is when you put the unit into the vagina. Once you have visualized the transition zone with acetic acid and you know what part of the cervix you want to ablate, you then push the button again. You'll hear another beep and the unit is heating up. It only takes 8 seconds for the unit to come to 100 degrees Celsius. As all of these buttons light up, you know that the unit is hot. Every 5 seconds, the unit will count down and one light will turn off, so you know exactly where you are in the process. That final beep indicated that you're done with the procedure. If for any reason you want to pause the procedure in the middle of the process, say your patient moves or something happens, you just hit the button again during the procedure and it totally shuts off. Now we can demonstrate how the unit works. Pretend this is your patient. And depending on which probe you want to use, it comes with 3 different probes. Well, it comes with 2 different probes. You have the choice of a 16 millimeter flat, a 19 millimeter nippled, or a 19 millimeter flat. So I'm going to use the one with the nipple. Again, just insert it. Here's your light. You push it once for your light. I'm going to insert it into the vagina, touching that part of the transition zone that I want to ablate. It may be helpful for you to warn your patient that they might feel a little warmth, they might hear a series of beeps, and they may hear a slight or faint popping noise. So I'm going to now ablate the tissue. Now it's heating up. It's about 8 seconds to get to the 100 degrees. It's now ablating. counting down by 5 seconds, so you know exactly how far along in the procedure you are. And 5 seconds left. And the final beep indicates that you're done. And then you just gently pull it out. And as you can see, the 19mm nipple left a very perfect ablation zone. You can also repeat this procedure if your transition zone is bigger than the 19mm or the 16mm probe. You can readjust and go through the process again, and you can treat the entire lesion. The probes can be cleaned really easily, so you just remove your probe. You can wipe down the handle just with alcohol, and then you take this probe, of course without the rubber stop, and you place it in a solution of glutaraldehyde. And depending on if you want to reuse the probe many times, I would recommend the glutaraldehyde solution, as you can autoclave these, but it will shorten the life of your probes. And then after you're done, you just put it all together, put it back in your case, and you're ready for your next patient. Let's go through some troubleshooting. So if for some reason the device is not working properly, you can determine whether it's in the probe itself or in the handle. So when you attach the handle and the probe, if for some reason when you turn it on, all of the lights come on and they blink, that means there's a problem with the probe. If you turn it on and nothing happens, no lights, no anything, that means that there's a problem with the handle. And there's no repair necessary. You can just contact the manufacturer or your dealer, and they can send you a new one, as long as it's under warranty and as long as it's not been misused or abused.
All right, Dean, if you can just switch your video back on. We've had quite a few questions come in, but if there's any kind of follow-up information that was not covered in the demonstration, feel free to chime in if there's anything that you feel would be necessary, but I think we'll probably end up covering it on the question and answer regardless.
Okay, well, just quickly, let me review some of the things in case the video was a little jerky and you couldn't see it. The device comes in a hard case, carrying case, so it can be used out in rural areas very easily. Has instructions for use that goes through most all of the issues and questions you've talked about here. Has the handle involved here, or included in a foam case. 2 batteries so that you can be using one and charging one if you need to. You can do between 30 to 50 treatments per patient. There has a recharger that can go into any outlet throughout the world with adapter for that country. Comes with 2 probes. Maybe it wasn't clear on the probes part of the thing. There are 3 different configurations of the probe. There's the 19mm with a cone tip, what she called the nipple. There's the 19mm flat, and then there's the 16mm flat. Those are the 3 options of the different ones, and those were the World Health Organization recommended configurations and design. Just one comment about the sterilization. The probes can be sterilized by several different solutions. Glutaraldehyde is the one many people use, 2.5% glutaraldehyde solution. Clorox also, 0.5% Clorox solution, or the PureSafe, which is the new one that's used throughout Africa. And simply after use or after treatment of patients, you can wipe down, clean any debris off with a mild detergent off of the probe shaft itself. Since the only part that's used on the patient is the end part of the shaft, we don't have to worry about sterilizing the connector part of it. And so the easiest way to do it is to clean off the debris, rinse off with water, and then put it in the solution for between 20 and 10 minutes, depending on which solution, which all this is covered in the instructions for use. 20 minutes, remove it, clean it off with sterile water, repackage it, and you're ready to go for the next patient. The handle can be wiped down with alcohol swabs or whatever's needed to, if that's needed to be done as well. So with that, I'll turn it over to the question period, and we'll go from there.
Great. And I know we had a few people that joined during the demonstration. So if you have questions, let me just circle back to that. There's a few different ways you can ask questions. There's one which is the question section of the software, where you can just type a question in, and then I'll ask that directly to Dean. And there's also the option where there should be an icon on your software with a little hand. If you click on that hand, it basically raises your hand, and it lets me know you would like to ask a question directly to our product specialist. So those are the two ways, but I do have quite a few questions in, and hopefully if you're not sure about your questions, this will answer a few of them. So the first thing was basically around the probes and any consumables. So I know that the probes have a certain life cycle. How many uses do the probes have?
Well, it depends whether it's been abused or not, but typically they're designed to last for a number of cases, so 50 to 100 treatment cycles or even more, depending on how they're treated in the high-level disinfectant, but they're essentially a reusable device.
Okay, and then are there any other products? I know that on the tips there, they have the flat or the cone tip. Are those a consumable, or is that just embedded with the probe and they'd be replaced together, basically?
Yeah, there's only basically two components. It's the handle and the shaft or the probe part of it. This is a single unit. It's all enclosed, attached together. You can't disconnect anything on the probe shaft. So if there's a problem with the probe shaft, you replace that, or the probe if there's a problem with the handle. And there's a simple diagnostic, as Dr. Jackson pointed out, of if you press the handle even without the probe in and you don't get any lights, then you know that it's a problem with the handle or the battery. If you put, and you notice that when I press that button, it flashes all 4 blue LEDs. That tells you something's wrong with the probe. Well, of course, I don't have a probe in it. So until I put a probe in, that's the message you'll get. When I put in the probe, then it'll go through a checking routine. There's a smart microprocessor in there that does all the checking to make sure that the probe is functional and working before you treat a patient. So you know that if you get to this point, ready to press, insert, and treat the lesion, you know that everything is working and will work for that patient, okay? And then you press it the second time, it'll go through heating. So it's heating through that while you're sequencing, it's heating up the probe to 100 degrees centigrade. And then it'll start the countdown. All blue LEDs are on. That means that it's up to 100 degrees. It'll start the timer, and that times for 20 seconds, or actually it's variable. Some people are using 40 seconds. In fact, most are using 40 seconds now. They're at 100 degrees centigrade. And that can be changed in the handle itself. And we can show you how to do that, or it's in the instructions for use of how to change between 40 seconds and up to 60 seconds, or 20 seconds up to 60 seconds, depending on your hospital and your procedure.
Perfect. That actually answered a lot of questions. Quite a few people had come in with questions just about personalizing it to each patient and each use case, if it could be used longer or shorter. The only thing that I think's not touched on is there any ability to adjust the temperature?
Yes, the temperature can be adjusted as well, from 80 degrees up to 120 degrees. That's all done in how you push the buttons to initialize it. And I won't go into that detail right now, but that's available, and we can show you how to do that. Most of the people that are been using it with the World Health Organizations have kind of centered on 100 degrees centigrade. This is from the studies from Duncan for 40 seconds. Actually, he did it, he shows it for 20 seconds. So Dr. Prindiville recommends 20 seconds with overlapping treatment. So you need to treat the whole cervical transformation zone. And so if you can't get it with one treatment with the tip, then you move it to the second location, push the button again, and treat again. So overlapping 20 seconds is essentially cover, for time for all lesions. But most people are using 40 seconds for a single treatment on that you can get the whole transformation zone lesion.
Perfect. And then just a couple kind of logistical things is, are you inserting the probe while it is heating up, or are you waiting until after it heats up, then inserting it?
Oh, that's a very good question. And in fact, went through a lot of design and questions out in the field about the best way to do that. This device is state-of-the-art technology. So the special sensors in here will heat up the tip in less than 7 to 8 seconds. And so we recommend the first press only turns on the LED so that you can see to get in the vagina to get into position. There's no heat on the tip at this point. Now you push it the second time when you're ready to treat. Now it's starting to heat up, and since it heats up in like 5 to 6 seconds, then you don't need to worry about burning the vaginal walls as you go in, touching it, and so forth. And you start the timing once you're firmly pressed against the lesion that you've prior diagnosed with BIA or other technique that needs to be treated, and then it'll count down for the time that you have your instrument set for. I hope that answered your question.
I think so. Yeah, I definitely think so. So then there's the question. I know it has the beeps as it counts down. And at the end of the final 5 seconds after that beep, does the device automatically turn off and start to cool down, or do you have to press the button in order to turn it off?
No, it automatically, at the end of the cycle, when you see all the LEDs go out, it turns off the heat to the tip. So it's cooling down immediately, and you've just treated for the period of time, like the 40 seconds, and then you can remove it because it's cooling down. And by the way, the side walls of the tip are not hot at all. They're less than 50 degrees. So even if you happen to hit the vaginal wall as you're coming out, you're not in danger of burning any of the vaginal wall.
Perfect. And then I know you mentioned it was something like 5 or 6 seconds to heat up. Do you have a general time frame for how quickly it cools down to a safe level?
Well, it depends on what you call a safe level. It's in 40 seconds or 50 seconds, it'll be down to room temperature or close to room temperature, but immediately starts cooling down after you remove it. Most users have not seen this as a problem at all because the sidewalls are the only thing that you can really touch. Vaginal wall, the side of the probe is the only area that you can really touch the vaginal wall, and that's already at less than 50 degrees centigrade. So that won't burn the tissue, especially if it's a momentary touch. The only thing that is hot is the very tip, and that, of course, it would be hard to reach unless you were really awkward to touch the vaginal wall with that.
Perfect. And then I think this will probably be the last one about how it's specifically used, but questions coming in about just visualization or camera, or can it be used with a camera if there's not one built into the device?
Okay, this device is the treatment part of the see and treat, or the screen and treat programs that are going on now throughout the low to middle income countries. And so normally what's done is a BIA, a speculum exam, VIA determination of what kind of lesion is there, if it's precancer lesion, meeting the standard criteria that the World Health Organization has outlined, and there was not time to go through that here, but it's readily available in the literature, then that forms a treatment method.
Okay, no, that's perfect. Let me just see what we're moving to. Okay, quite a few questions about just competitive products. How does this compare to something more traditional, and kind of what sets this apart versus the more traditional and makes it more user-friendly, more mobile, notably in lower income countries?
Sure. Well, if you're familiar with the screen and treatment programs out there of treating the treatment phase of the screen and treat program, most of the users have been doing cryotherapy or cryogenic, which is freezing to a -60 to -80 degrees centigrade. But that is a very awkward treatment modality, because not practical, because you have to do a 3-minute treatment, a 5-minute wait, and another 3 minutes. So you're 11 minutes in the whole treatment cycle. And with the thermocoagulator, which is a thermal destruction of the ablation of the tissue, you only need a 20 to 40 second cycle. So you can see how much difference in practicality. The other thing is the cryogenics is not practical because people run out of gases, and it's very expensive to replace the gases and so forth. In addition, cryogenic instruments typically will have problems with maintenance and plugging and that sort of thing. So you don't know if you're really delivering the -60, -80 degrees centigrade. So that creates a problem. Just a little history. The company called Weissap over in Germany originally came out in the 1960s, 1970s with what they call the cold coagulator, which is a misnomer. It's not cold at all. It's 100 degrees centigrade, 100 120 degrees centigrade treatment. So it's a thermal ablation of the tissue, not a cold. But they called it cold because relative to electrosurgical units were 300 or more degrees centigrade. That's relatively cool. So that was been used throughout the 80s, and many studies have been done by Duncan. And there's a article that summarizes this by Dolman that shows that the efficacy of thermal ablation is equivalent to cryogenic or freezing. So that device has been available for a number of years, but it's very bulky, very expensive, not practical for taking it to rural areas. We come out with this state-of-the-art device that uses all the features to make this more modern treatment and better control on the temperature. I understand why Weissap has come out with a new model, but the problem is they have a shaft that you got to clean. They also have a tether that comes off of it with a cable. We have patent process that patents our design and application, so that it makes it very practical, easy to take out in rural areas, treat a number of patients, 30 to 50 patients treatment, and with each battery charge, and then it's maintenance. It's no repair. You can diagnose whether it's the handle or whether it's the probe. If any problems like that, we'll just replace that if it's under warranty or hasn't been abused.
Okay, perfect. And I know you mentioned that the battery life lasts for quite a few patients. Is there a standard number of hours that the battery lasts per charge?
Well, it depends on the treatments, really, because the only time any power is being used on the battery is during the treatment phase, and it uses minimum amount of energy even for that. So we have found that you can do between 30 to 50 patient treatments. Now it depends if you have multiple overlaps that you do on one patient. Of course, that's going to count for several treatments. But we found that the 30 to 50 treatments, and very simple to take the battery out, put the other one in, put the second battery in that's provided with the unit, recharge the battery that you're using. It only takes like 2 to 4 hours for full charge, and you're ready to go again with the patients. Usually we find on these clinic screens that are being done that no more than 20 to 30 patients are even done in a full day's exam and treatment period.
Perfect. And then as far as charging the battery, is it only chargeable in a wall unit, or can that also be charged with an external battery, or for example, through a car charger or something like that?
Yes, anything that'll provide anything between 110 to 240 volts, 50 to 60 hertz will recharge it. So you can actually take this unit here, and if you have a solar generator or a generator that is run on gasoline or what have you, that can also be used to recharge it.
Perfect. No, I think that's a lot of people's questions, just because they may be out in the field in a more remote area. So being able to charge on the car is a major advantage.
Right.
Great. And so I know you mentioned a moment ago warranty. It did get a bit choppy there, but can you just touch on quickly what the warranty is and if there is a separate one for probes and the handle?
No, it's the same warranty for the probes and the handles. It's 1 year, non-abuse. We found people 2 to 5 years haven't had a problem. We haven't had it out 5 years, but if there's not abuse, we will stand behind it and replace it.
Perfect. And then just I think a couple questions have come in about more of a company information is where is this manufactured and where does it ship from?
Yes, it's manufactured here in the United States. It has the FDA approval on it, CE mark approval as well. Here in Utah, we manufacture it ourselves. Of course, the computer boards and so forth are done in job shops, and we bring them in, do all of the screen treating. We assemble and ship here from Salt Lake City, Utah, USA.
Excellent. And then I know you mentioned being fairly well used in lower and middle income countries. Do you have an idea of how many countries it's been used and what penetration it has into South Asia and Africa?
Yes, we're in over 30 countries now where it's being used actively in treating on these screen and treat programs. It's throughout Africa, of course, is the big one, India, Vietnam, Latin America, several clinical studies are going on now. One big one is in Zambia, where Dr. Grossbeck Parnham is doing an NIH grant of over 4,000 patients to show the efficacy equivalent. World Health Organization, we understand, is reviewing that with a committee, and they're going to recommend thermal coagulation or ablation equivalent to the cryogenics.
Excellent. That's great. I think just a lot of people are curious about whether it's already been used in similar environments. And so the fact that it has is quite a bit of help as they try to introduce this to any of the clinicians or different hospital settings. So just really one last question has come in, and then we can touch on anything else you think you'd like to talk about. But the last question just being about the training. Is there any extensive amount of training needed to use this? It seems simple, but is the user manual enough typically, or do people require any kind of a one-on-one training beyond that once they have the device?
The instruction for use really cover everything in depth well enough. Other thing we should remember about this is really the treatment and so forth comes from the screenings to identify the lesions. So once that's identified, you know where you want to treat. The cryogenic approach, there's no real difference in the treatment other than the simplicity and the shorter period of time of treating the lesion, just like you've done with cryogenics. And so most all of the programs that are out there that do screen and treatment programs to treat these lesions are already trained, so they know everything. So now it just becomes simply what we went through with the video, and you can review the video from Dr. Jackson there that will cover most everything, well, everything that you'll need to know on how to treat it. And then with the individual local programs that you have, you should use those procedures, of course, in your standard screening and what you should treat, and then how you should treat it. It's simple because it's just a application like it's being done now with cryogenics, only with a shorter period of time and an easier used instrument to do that treatment modality.
Perfect. And then just to show my screen quickly, just as Dr. Wallace mentioned a moment ago, the video with Dr. Jackson is here on the product page. So if you do have an interest in watching that again, once we finish this edit, that will also be on this training video section. But if you wanted to review that video again, it's here. We have a lot of people asking questions that are either been covered already or are on the product page. So any questions that people have asked specifically about the regulatory approvals, again, are mentioned here, FDA, CE. There was a few questions about whether or not there's a brochure available, which again is right here. And a lot of questions about specifications, which again, here on the product page, you see all the specifications listed, anything that's required there. For any of the people that have been coming to us on this questions panel here, asking about quotations, orders, different details like that, here's how you can follow up with us. Obviously, if you're a verified distributor with VIA, you can contact your sales representative. If you're not sure who that is, please contact us through email or WhatsApp, or put a site request directly on the website, and we're happy to answer any questions there. That, Dr. Wallace, if there's anything I can touch on in the question you'd like to finish off with, otherwise I think we can consider the questions finished. I appreciate the thorough nature of the answers.
I don't think so. There was one question about the battery life. The battery life has an indicator on here. A yellow light will come on when the battery gets low enough that you need to rechange it or change it to a new battery. When that light comes on, you can still treat several patients before the battery will totally flag you and say you need to change it. So, but you should change it once you see the yellow light come on. I think that's all I really had.
Well, thank you very much, Dr. Wallace. I know that will be a great deal of help for our network of distributors here on the line as they look to introduce the product and also to inform their customers about the benefits of using it, and then just the general understanding of how to use it. So that will go very far in introducing this and expanding the access and awareness of the thermocoagulator. Again, for those of you on the line that want to learn more information, you can search for thermocoagulator here on the website, and you can find all of the pertinent information you're looking for based on your tenders and inquiries, things like the pictures of the product, the regulatory approvals. You can find all of your details about product specifications and further information on what the product does and how it's different. And then we also provide you details like clinical trials and training videos and anything further on that. And you can find that on any of our pages for any of our products. As I said, we have thousands of products on the site, some of the most innovative in the world. And what we're trying to do is give you all the information you need in a very transparent and concise manner so that it's very easy to digest, and then have your fast and easy answers there. So with that, I want to thank everyone for joining, and we look forward to you on the next VIA Live product training webinar. Thank you very much.